Hi there, I'm Dr. Carlo Rinaudo from Neurologic Education, and I wanted to take an opportunity to expand on the sensorimotor portion we have planned for our upcoming brain-body connection seminar, which features Dr. Kelly Holt, myself, and co-owner Dr. Paul Bergamo. At this stage, you're hopefully aware that Kelly will be expanding on the evidence supporting chiropractic, especially on its influence on the brain and spine function and overall health. Paul's put together a great segment on communication and how we can help as many of our existing patients as well as those in our community on falls risk. As for myself, my area of interest lays in translating research into practical applications, and more importantly, how can that be used in everyday chiropractic office. This seminar is aimed not only at the novice practitioner with little or no neurology background, but all the way up to those that hold a diploma in chiropractic neurology level and everyone in between. So whether you're a student or a seasoned practitioner with many years under your belt, this seminar will have plenty to offer you. We also appreciate that many of you attend a seminar wanting to be sure that you can apply as much of that as you can. So what we want to do is we're putting together a great validated assessment and management tools and therapies, so make sure that you can make an immediate difference to your practice and patients. Well, for those who attended my dizziness seminar last year in 2016 will know that's exactly what you're going to get. One of the two sections I'll be covering with Kelly is on sensorimotor function. Essentially, it looks at how the brain and body are connected, and as chiropractors, how can we influence the brain through our spinal care, as well as look at the brain and assessing spinal function. In preparing the content and reviewing the literature for this section, it really became obvious that it highlights the importance for chiropractors not only to simply look at the spine as a standalone structure or to evaluate alignment as a static feature, but rather we should be looking at the control of the spine as its defining feature. This spinal control is really augmented and influenced by the brain via the sensorimotor integration. Essentially, the quality of information that comes into the spine, from the spine to the brain, how the brain integrates this information with other senses and our previous experience, and finally a motor output controlling the spine and our other structures. So I'll be covering how to perform a sensory test, which involves a sensory discrimination test, joint position awareness, and validated balance tests that you can perform in minutes in your office, giving you validated outcome measures, essentially as we need for today's climate with our patient care. We're really excited to be showcasing some low-cost, quick and effective pieces of equipment that will enable you to perform these tests very objectively. Unfortunately, I think as chiropractors, we're falling behind the game a little bit when it comes to understanding and communicating this brain-based approach in a very contemporary way. One of the goals that neurologic education has is to provide chiropractors with the understanding and application of clinical neuroscience to ensure that we enhance our patient outcomes as well as enhance our profession's standing in healthcare. Keep in mind that our seminar is 12.5 hours FLA approved, which meets all your CPD requirements in one seminar, and that early bird closes soon. So make sure you get in now and secure your seats and save a couple $100 on registration. Registration details can be found below at www.neurologiceducation.com.au. We certainly look forward to welcoming you and seeing you soon. Bye for now.